Hi, my dear students. So today, I like to start up a new series, in which we'll taking up the systems, and we'll discussing up along with the questions regarding that particular organism which is there in that particular etiology, which I ask you as a case scenario. Okay. So first of all, we are taking up gastrointestinal and hepatobiliary system, and the first question which is there for you is a 50-year-old traveler. That fellow have consumed up roadside food during his visit to a seashore. After 3 days, he suffered from mucopollulant stools with blood. So obviously, bloody diarrhea happened. Admitted to the hospital, stool sample is taken for the microscopy and the culture. The stool microscopy shows what? Plenty of pus cells and RBCs, and obviously pus cells means inflammation. Okay, and RBCs are there, so that is a sort of a dysentery. The culture grew typical non-lactose fermenting. This is important. Non-lactose fermenting. Another important word which you need to find is non-motile, gram-negative bacilli. The patient is being kept on symptomatic treatment with a plenty of electrolyte substitution. The patient recovered after 1 week. What could be the most probable diagnosis of this particular case? So, guys, there is no very difficult task to answer of this question. You already know it. You are intelligent fellows. So, answer to this question obviously is Shigella, and we are talking about bacillary dysentery. And number of hints are there in the question, which you already know that these particular ones they are having this particular thing non-motile, non-lactose fermenting, and it is causing up a bloody diarrhea. It may go towards the E. coli also, that EHEC and those particular ones, enteroinvasive E. coli, they can also does the same thing. But the only thing is they are not non-motile. Okay, they are lactose fermenting. Fine. So these are the important points which you need to segregate up at this particular juncture. So now if we talk about the Shigella, guys, Shigella you already know that it's a gram-negative bacilli. It's a non-motile one which we just had done. Mannitol based fermentation. This word mannitol based fermentation you need to know regarding the Shigella. Okay, the mannitol based fermentation is used to classify this, but one organism, Shigella dysentery type 1, is a bad boy of this particular Shigella family, that is catalase negative. Along with that, that fellow is non-mannitol fermenter. And you already know that what is the most common cause in the world, Shigella soni, in the India, Shigella flexneri, and these all they does release this particular toxin which you say VAMA, that is VAMA is virulence marker antigen. Because of that, this invasiveness is there in these particular fellows. Okay, so this is what you need to know regarding it. Along with that, firstly it is diarrhea and later on it changes to bloody diarrhea, so that also needs to remember. Important here is this particular entity to know that they might ask you that after weeks of this particular bloody diarrhea, somebody is having what? Somebody is having pain in the joints. Already asked question of INI-CT, and the answer to that particular stuff is what, guys? Reactive arthritis. So reactive arthritis is common after the Shigella infection, and as far as the culture media are concerned, they are altogether the same as of Salmonella. Okay, the only difference is that you could not able to use Wilson and Blair. Otherwise, you can use up Sachs buffer glycosylline for the transport, Salmonella Shigella agar as a selective media also, and if somebody asks you enrichment stuff, that is selenite F broth. Okay, but for the selectiveness, Wilson and Blair is excluded up. Otherwise, you can use Salmonella Shigella agar. You can use HE, that is Hecton enteric agar, and along with that DC and XLD, they can also be done. Okay, important regarding this particular aspect which you need to know is that Shigella dysentery type 1 is the organism which is catalase negative. Otherwise, nobody else is catalase negative in this particular family. Fine. So basically, if it is this question comes up in your exam, so what you will take up? A fresh stool sample. Okay, you will take a fresh stool sample. In which particular media will transport it? If you are at a PHC center and you want to diagnose it up, obviously Sachs buffer glycerol saline. What you will observe in the wet mount of the stool? Wet mount of the stool, what you will observe, guys? It's already saying the pus cells are seen up. So obviously, what you get in that, the pus cells and RBCs, that will be observed in the wet mount of it. And then you can put in enrichment media, that is the selenite F broth, and then you can put it on the selective medias and stuff. Right? So these are the important entities. Whenever this question comes, these all things can be asked from Q. And one last point here is Shigella and Salmonella, they enter into our system through the M cells. These particular name you should know that what are these M cells. Because of them only they gain entry, and because of that only the invasiveness happens of this. And the important factor which plays up in that invasiveness role is VAMA. And what is VAMA? Virulence marker antigen. Is it fine, guys? So I hope you will find this particular case scenario studies helpful. I'll be coming up tomorrow or day after tomorrow with some new stuff. Thank you.